Hi, everyone. Welcome, welcome. We are going to get started in just a minute. We have quite a few people logging on right now. So thank you for joining us today. And we'll get started in just a minute or two. Hi, everyone. We're going to get started in just a minute. Thanks for joining us. Okay, well, it is 2 past the hour, so I don't want to waste any more time. We're really excited about today. Thank you, everyone, for joining us for the NCCRT Blue Star conversation. Today's Blue Star is presented to you by our Policy Action Strategic Priority Team. I'm just going to go over a few pieces of housekeeping for you before we get started. So you should have received a notification at the beginning, but this session is being recorded, and a video recording of the presentation will be shared following today's presentation. So by participating in this webinar, you give your acknowledgement and consent for the recording. Please make sure your microphone is muted during the session. You'll have the ability to mute and unmute yourself to participate in today's call during our question and answer session. If you do have any IT difficulties today, please send me a direct message and I'll be on the side trying to assist you. If you have video capabilities, please enable them during the Q&A portion of today's session. It makes for a more interactive and engaging session. It's always nice when we can see each other. And there is a raised hand feature. So if you kind of go down to that toolbar at the bottom where you see mute and stop video, you'll see reactions. If you click on that, you can raise your hand. You can share other emojis like a smiley or a heart. So feel free to express yourself today on today's call. And we'd like to know who we have today. So if you could go ahead and put your name, where you're from, and which organization you represent in the chat. We'd love to get to know each other and see who we have with us today. So with that, I will pass it off to our NCC chair, Dr. Stephen Itzkowitz.
Thanks so much, Caitlin. Can everybody hear me?
Yes.
So welcome, everyone. Thank you so much for taking time out to join us today. I'm sure you're going to learn a lot because I'm expecting to learn a lot as well. And as Caitlin said, this is one of our Blue Star conversation series. And today's session is hosted by the Policy Action Strategic Priority Team. So for those of you who may not be aware, at our last annual meeting in the fall, we experimented with a format of presentation whereby there would be a speaker on a topic, and then after only about a 15 or 20-minute presentation, we broke out into small groups and discussed the theme and then regrouped again. And that was very well received because it gave people an opportunity to really interact. And also, it was not your typical webinar kind of format. It was a shorter presentation with a lot more time for questions and interactions. So because of the popularity of that format, we decided to introduce this Blue Star conversation series throughout the year. And it's an opportunity for our various strategic priority teams to connect with members and member organizations and for you to ask questions to experts. So today we're really delighted that we have, well, I'll introduce Heather, who then will introduce our speaker. Just to know that you're welcome to join future Blue Star conversations. It's open to NCCRT members, comprehensive cancer coalitions, and CRCCP grantees. So we really welcome your input and your questions. So let me start by introducing Heather Dacus. So for those of you who don't know, she co-chairs the Policy Action Strategic Priority Team, and she joined the New York State Department of Health in 2007. And she serves as the director of the Bureau of Cancer Prevention and Control to support population and evidence-based initiatives to reduce the burden of cancer across New York State, with a specific focus on cancer prevention, screening, and survivorship. She oversees implementation of multiple state-funded programs as well as CDC and prevention grants, and including the National Breast and Cervical Cancer Detection Program, the Comprehensive Cancer Control Program, and the Colorectal Cancer Control Program grant. A board certified and New York State licensed preventive medicine and public health physician. She earned her master's in public health degree at University of Albany School of Public Health and her osteopathic medical degree from the Philadelphia College of Osteopathic Medicine. Dr. Dacus is a steering committee member of the New York State Cancer Consortium, the Citywide Colon Cancer Control Coalition, the C5 Coalition in New York City, and she co-chairs the Policy Action Work Group of the National Colorectal Cancer Roundtable. She served as an outside expert reviewer for the Cancer Prevention Research Institute of Texas, the Prevent Cancer Foundation, and the American Cancer Society. She's also a member of the New York State Department of Health Institutional Review Board. Prior to pursuing a career in public health and joining the New York State Department of Health, Dr. Dacus spent 6 years as a general medical officer in the United States Navy, providing direct medical care to sailors and Marines assigned to her units in Washington, D.C., Okinawa, and upstate New York. She's married to her husband, Daryl. She's a stepmom, dog mom, and grandmother of 3 and teaches yoga in upstate New York. So she has quite a list of credentials. So Heather, thank you so much for chairing this session, for emceeing the session, and we look forward to a really exciting session. Thank you.
Great. Thanks so much, Steve. And it's great to be here, and welcome to everybody who is joining us, including many members of the roundtable and many members of the Policy Action Strategic Priority Team. The long-term mission of the Policy Action Task Group is to address pressing policy issues that can help increase the uptake of colorectal cancer screening. And the group, the task group itself recognizes that with effective policy, legislative, and regulatory changes, we can make colorectal cancer screening more affordable and accessible as a nation and in our local communities. And Steve mentioned that at the recent annual meetings of the Roundtable, the task groups have met, and at our recent policy task group meetings, a lot of conversations have come up as they relate to the various colorectal cancer screening measures that exist. And oftentimes policy conversations end up involving what is and is not being measured and how those measures work. So based on all of that, we decided that a focus needed to be done on the different measures. And so that's what's bringing us here today. So overall, our goals for today's call are to provide an overview of what it means to be a measured steward and what the different CRC screening measures are, review recent changes to the HEDIS colorectal cancer screening measure and implementation timeline, and review how changes to measures are made and how we as National Colorectal Cancer Roundtable members can be engaged in that process. And so to help us with this conversation, we're thrilled to bring to the table our great colleague, Dr. Mary Barton. Mary is Vice President for Performance Measurement at the National Center for Quality Assurance. The NCQA's Performance Measurement Department is primarily responsible for creating and refining quality measures in partnership with various stakeholders. Dr. Barton oversees the team supporting new quality measure development and the upkeep of existing measures in the healthcare effectiveness data and information set, which we all just lovingly refer to as the HEDIS measure set. She provides direction related to evaluation of healthcare, including performance measure development, application, and maintenance of measures. She leads a number of different grants and contracts, is a member of NCQA's leadership team, and she represents the NCQA with various different stakeholders, including the Centers for Medicare and Medicaid Services, or CMS, different professional physician groups, and leaders of health plans, insurance companies, and consumer groups. So please join me in welcoming Dr. Barton to today's conversation. Hi, Mary.
Thank you so much. I'm very glad to be here.
Welcome. Yeah, it's great. We're really excited. We have a lot to learn, and the group that's joined us definitely represents that sentiment. So we'll dive right in. Does that sound good? Okay. All right, so our first question, Mary, is can you briefly tell us about NCQA's role in measuring colorectal cancer screening and what it means to be a measure steward or stewardess?
Sure thing. So NCQA created the colorectal cancer screening measure 25 to 30 years ago, it was one of the early measures that was used in the HEDIS data set. And over time, we have updated it as new screening modalities have come along and as new guidelines have been released. And we look to primarily the U.S. Preventive Services Task Force, which makes guideline updates to their colorectal cancer screening guideline regularly. And what it means to be a measure steward basically means that you're committed to keeping something up to date. Really, at the at the root of it, a measure that was created in 1985 wouldn't include FIT testing. It wouldn't include fecal DNA. So without a user of the measure, most often will be capable of being a steward of a measure. And so that means that both in terms of NQF endorsement of a measure, that NQF recognizes you as the group that is committed to keeping the measure updated. CMS recognizes the responsibility of keeping the measure updated. So that's what, that's basically what that means. And then I was just going to tell you a little bit about how we think about quality performance measures, because we use the measures that we design in health plan evaluation. So when we design a measure, we have to design specifications that will be easy for everyone to understand the same way, so that you can have an apples to apples comparison among health plans. We also test measures as we are creating them, or sometimes when we're updating them, in data sets that are relevant to the data that we need. So if it's a measure that only uses claims-based data, then we can test it in a big claims data set. If it's a measure that needs some clinical detail, then we can test it in an environment, either a health plan environment or another environment that has clinical data in it. And then we use the measure, and this is so important. I can't maybe say this enough times, that the use of the measure means that we get a constant flow of questions about whether people are doing it the way they're supposed to do it. So we run a policy clarification system at NCQA where any users of our measures can submit questions. And it is those questions that help us to know whether our specifications are in fact idiot proof, to use not a good term there, but we want to make sure that everybody can understand it the same way. And if people have questions, then that means that we need to be more clear or more precise in our descriptions. So our use of the measure is really a key ingredient to our keeping it up to date and keeping it crystal clear. The data collection is also part of what NCQA does. And I know this is relevant to another one of your questions, because when NCQA collects data from health plans, whether they're Medicaid, Medicare, or commercial, that data is audited. So NCQA uses an audit program to direct contractors to look at last year's data and this year's data and look for anything that might be, a questionable change, and to interrogate the health plan, even to the point of looking at the base, information. So that audit is really an important part of NCQA's use of our measures, because we believe that we can then rely on that comparison, and we can, we can talk to people about, this plan did better than that plan, and we really know that it's true. And then finally, the endorsement by NQF. So NCQA I know it's confusing to some people.
Some
These
alphabet
two-
soup, right?
Yes, these two names are similar. But so NCQA, we design measures and then we use our measures in our programs, our health plan accreditation program.
Mm.
NQF is an independent entity that's funded by the federal government that endorses measures. That's their role, is to say, is this a measure that's designed well? Is it feasible to use? Is it giving, a reliable answer?
Mm. Yep.
And so that is part of the stewardship agreement. So if we are the steward who has submitted the paperwork to get it NQF endorsed, then NQF recognizes NCQA as the steward of that measure.
Yep. Yeah, no, that's great. I'm glad that you are explaining these different steps. I think it's helpful for all of us to understand the behind the scenes work that goes into that, and definitely being able to verify that the data is saying what it is by doing the audits that you described. Yeah, and then people can kind of rely on the data like you're saying. So yeah, that's really helpful. I think on the slide right before was getting at the next question that I was going to pose was, there are a few measure sets for colorectal cancer screening, including HEDIS and the Centers for Medicare and Medicaid adult quality core set. And can you just talk a little bit about how do the Medicaid adult core set intersect with or correspond to the HEDIS measures? And
Sure.
sort of what are the nuances we should all understand about these two things?
Sure. So the adult core set for Medicaid is a federal effort that CMS convenes, and they don't design measures. They look for measures that are out there and decide whether to add them to their core set.
Okay.
And so they selected the NCQA measure in 2021 or 2022. Well, they selected it in 2021. So they selected the measure that has been the HEDIS measure for a long time. It happens that in 2022, we updated our measure. And because of the federal calendar being different sometimes than the HEDIS calendar, we're going to have to wait a little while until the CMS catches up to our new version of our measure. But it is our measure that they are using.
Okay. That's great. So they're just using it to measure a different group of entities, so to say. The HEDIS that you're looking at health plans, and they're using it for a different audience, if you will.
Right, because they are looking at state Medicaid programs.
Right.
And so the adult state, I do want to point out that the adult core set is not, I do not believe there's any enforcement as to states having to report it. I know that in the past it was completely optional. It's getting more and more, there's going to be more regulation about it. And I think that states are going to have to report these measures, but there is not, to my knowledge, any audit that goes on in the Medicaid core set. And so it's not only that they're using the measure in a different setting, but they're using the measure in a different way.
Okay, that's great. That's really helpful. Thank you. So another question that sometimes comes up is, what are the roles of NCQA and CMS in developing the Medicaid measures? And I think you just answered this. Who is the decision maker on the Medicaid measures? Can you just...
Yeah. So NCQA is a measure developer. And so if we have a measure that CMS wants to use, they can do that. So they are the decider about what goes into the core set. But, part of the changes that we made to our colorectal cancer screening measure this year was to add it to our use in Medicaid health plans. So we're going ahead and using it in Medicaid health plans, our measure, which goes down to 45, starts at 45. And CMS, because of its timeline, it's sort of hooked on to the old version of the measure for the Medicaid core set. And so we'll just have to wait until the next time that their door opens up again to get it updated.
Great. Okay. And I want to acknowledge that I'm already seeing some good questions coming in on the chat feature, and I know we'll be getting to everybody's questions once you and I sort of go through a few overarching ones. So it's good. So, but please, otherwise people keep putting your questions in the chat feature for us. All right. So next question, Mary, will the changes to the CMS adult core set to include colorectal cancer screening be seen in all state Medicaid programs and plans? And otherwise, what would we need to know about this particular landscape?
Yeah, so that's a really good question. And I don't know the answer to that because CMS runs this adult core set and child core set program. And I know that they encourage states to report, but I don't know that every single state, I don't know when they're going to have to.
When they're gonna make them, so to say.
Yes.
Yes. Okay. Fair enough, right? All right. Very good. Let's see. So next question, and I think there'll be a slide for this one too. If not, we'll work through that. So we know the CRC screening HEDIS measure is updating to include measurement of screening at age 45. You just mentioned that. Can you comment on when HEDIS reporting of CRC screening at age 45 will begin? When would that data start coming in?
Yes. So the NCQA measure was changed in 2022, and so that will apply to 2023 care. Okay. So starting next January, the care that's provided in 2023, no, I'm sorry. I got that wrong.
That's good because it helps to know that it confuses even you. So
yes,
that's okay.
I get confused. Yes.
Yes.
So we added Medicaid and expanded the age range to 45 to 75, starting in measurement year 2022. So that's the current year. So that will be reported to us in June of 2023.
Okay. That's great.
So that is the first time that we would have data. And this is a big change to the measure. So I'm not sure. It would depend on our Committee on Performance Measurement, which oversees our measures, would have to decide on whether it was a change that was significant enough that we would have to move the measure back into first year status, which means we don't publicly report the results, or if this change was sort of a not too great extent and we could continue to publicly report the measure. Okay. So I won't know that until next year.
Right. Once you see the data and you make sense of it next June when it starts to arrive.
Yes.
Okay. And then the subsequent questions that you see here, a lot of us as members of the roundtable are interested in how measurement starting at age 45 differs across the different measure sets. So HEDIS has adopted it, like you just said. Your awareness of the other measure sets adopting the 45 starting age?
I am very confident that the next time the adult core set has a reopening every year, and so the next time it reopens, I'm confident that they would update the specifications to our current specifications. Okay. And the same thing, I know there's some questions about the ECQM. The ECQM is also stewarded by NCQA. So at the time when the federal government was pouring a lot of money into EHRs, they put a little bit of money into creating measures for EHRs. And so since NCQA owned a bulk of measures, they had us do some of that work. And so the ECQM, which is used in the uniform data set that FQHCs report,
Thank you.
has the old age range in it. So that too will be updated when the ECQM comes to be opened up. So that's on yet a different calendar.
Okay. Am I oversimplifying it by saying, Mary, that because NCQA is the measure steward, that these other users of the measures will sort of follow suit to what you've done with the HEDIS measure with the 45?
That's exactly what I would expect. That's exactly what I would expect. And it just depends on when they have their routine opportunity to update specs.
Okay. Okay. And then expect it of the people that they're measuring to be able to respond to them with that data.
Right.
Okay. I think we talked about the second question here. The final one on the slide, what can you tell us about the timeline and decision makers for these other measure sets?
So I do know that the CMS adult quality course set has an annual sort of reevaluation. And I am pretty sure that the ECQM program that CMS runs also has an annual evaluation.
Yep.
And I just don't know whether it's coming up in the fall or next spring, basically.
Well, and then as you were just saying that, I was thinking that Caitlin and Yvonne and I, one of our after meeting steps could be to just put those things together in one place, a document. What's the timeline for these different measures? And we can run that by you for verification, if that makes sense. And then we can share that with the rest of the group.
Absolutely. That sounds really valuable.
Okay. All right, great. Just a few more questions here for us. So many NCCRT members are working to address racial disparities and improve outcomes. What can you tell us about the potential to stratify the HEDIS colorectal cancer measure by race and ethnicity or other demographics like age and geographic location?
Well, a larger effort to present stratified data on HEDIS measures has been undertaken and announced. And colorectal cancer screening is one of the first 5 measures that we're asking health plans to report in that stratified way. And that data will also not be coming to us until June of 2023 because we've committed to health plans to giving them the specifications before the measurement year. And so that just has meant that we don't get the data until, a little time goes by. And the other 4 measures that are being stratified, that's a good question. Let me see if I can find that answer while we're talking.
We're multitasking, seeing the good questions in the chat. Yeah.
Well, then it's a great question. So the 5 measures that are being added to HEDIS 2022, so the care that's provided this current year, are colorectal cancer screening, controlling high blood pressure, hemoglobin A1C control for patients with diabetes, prenatal and postpartum care, and child and adolescent well care visits. And they're being stratified by the OMB categories of ethnicity. So, that standard set of categories. And you had some other questions about region or other, income. And that is, that's not what we're asking health plans to do right now. But you can review regional differences in the data that we provide in our Quality Compass tool. So we do report on what the health plans have reported to us. And I do believe that you can look at that by state or by region.
Okay. Okay. And when on the race ethnicity piece, just to clarify, you said that the categories for race ethnicity would be based on the Office for Management and Budget's OMB's category list of categories.
Correct.
Okay. All right.
So the ethnicity is Hispanic or not Hispanic, and then the races are white, Black, Asian, probably Native American. I don't want to try to reproduce it because I might miss something.
Yeah, no problem at all. All right, well, thank you. It's good to know that this is going to be happening because again, we are really trying to understand and make improvements in populations where there's a disproportionate burden of disease. So thank you for that. Then last question that I'll get at, and then we'll open it up to the group is, I know we can't really speak to the specific timelines for when public comment on the different measures is taken. We're going to do that as a post effort from this call. But can you just talk about public comment? You talked earlier about how these measures are created and the way in which you collect data on them and really try to keep them up to date. What role does the public play, or in our case, members of the roundtable who are really interested in a particular topic? Can you describe that a little bit?
Sure. So HEDIS makes use of a standard public comment period every February. So February into March, we have a 30-day public comment period. And that's where we bring all of our standard timeline measures, whether they're new measure ideas or revisions of measures. They all go to public comment. And that's really a very important part of our approval process, because we might hear that something's not as clear as we thought it was, for example,
Right.
in public comment. And the as it turns out, this past year, because of the timing that the U.S. Preventive Services Task Force released their updated colorectal cancer guideline, we actually had a off-cycle public comment period in the fall. And so that was last October, I believe. And that was, because we wanted to update the measure in time to release it in our February update so that it would apply to measurement year 2022. So that's why we did the off-cycle public comment just for that time. But, we are certainly glad to have NCCRT, be recipients of notification for, you can sign up on NCQA's website. I'm confident that there's ways to sign up to be notified about public comment and about, all the things that, of course, NCQA stewards more than 80 measures. So many of the measures might not be of interest to you all, but the colorectal care.
Thank you so much. Heather, do you want to wrap it up? And
Yeah. I think we've learned a lot. And some of the follow-up that we've described that we'll do, I think is going to be really helpful. I do want to first of all, Mary, thank you so much for taking the time between me and Caitlin and Mary Doroshenk being in touch with you over the last 6 months. You've been just a wealth of information. So thank you for that and for being on with us today. It's completely invaluable. And we look forward to continuing the partnership with you and NCQA.